thank you to the Good Governance Institute for inviting me to speak. My presentation is less focused on the community, but more on Black people and the mental health system, but also hopefully it will provide some insight as to why Black people don't have a good track records with regards to IAPS. And that is something clearly that we will need to be looking at addressing in the fullness of time. So, Paul, that introduction has sort of touched on the fact that I am a mental health nurse. I'm a retired one, in fact. And yes, indeed, I spent most of my life in my career working in forensic psychiatry. Don't beat me up for it. I was raised and started my career in Birmingham, but I later moved to London, where I was working there for a while, but then I was commuting to roles in Sussex and Hampshire. My only reason for mentioning is that is because it has given me a good oversight of the experiences and service provisions afforded to Black people across a variety of communities. So my talk is regarding the experiences of Black people, their mental health, and mental health services they access and rely on. What I did was I looked at research into the topic, and I'm going to cite a few of those research projects. But firstly, I want to touch on the messages highlighted by the Race Equality Foundation's briefing paper 2007. Because I believe that they serve to frame the experiences, relationships, and interface of this group with mental health services. Next slide, please. So if the briefing paper talks very much about, it highlights the issue about racism, and mental health services, but it also describes it as being very, very complex. And we can see that in terms of the presentation of Black people within the systems. So I won't read all the slides, so I'll leave it to others to read that. However, we need to appreciate that this is a problem that is long-standing, and not least, you know, I cite the 2007 paper, and I also cite earlier papers because very little has changed since those papers were written. Importantly, I think mental health is not hugely dissimilar to other services for Black and African people and the BAME community, in so much as they have a really sort of negative perception of mental health services, and as a result of which they delay seeking help, and that has a real negative outcome on how they are treated when they are admitted to mental health services. It is also important to note that we do not provide enough of a building block to enable BAME people to trust the services, and that they will address the damaging effects of racism. So, having looked at this paper, that is the context in which I have looked at this presentation. So if I move on then to some of the research that's fed into this, what Kwame Mackenzie said was that services have some way to go before they meet the challenges of a multicultural society. And that's evident from the work that was done by the Race Equality Foundation. But he also goes on to say that Black people within these systems need to be doing more work to make the services more responsive and ones that will meet the needs of this patient group. In 2007, the Healthcare Commission reported the findings of Count Me In, which was a one-day census of the National Health Service hospitals, private mental health hospitals, and also learning disabilities unit. And it made a grim reading then for people of African and Caribbean origin living in England and Wales. The survey was of more than 32,000 inpatients on mental health wards in 238 NHS and private hospitals. And they reported that 21% of patients were from Black and minority ethnic groups, although they represent only 7% of the population. That is, I mean, it's astounding. The study also goes on to say that rates of admissions were lower than average in the white British, Indian and Chinese group, but 3 or more times higher than average in Black African, Black Caribbean, and white and Black Caribbean mixed group. So not only were these people more likely to be admitted to hospital, but those in hospitals were 19 to 39% more likely to be detained under the Mental Health Act. And once in hospital, this group of people had the longest stay. So you had the Black Caribbean and the AME group staying in hospital for a longer period of time. So, and again, the study talks about the high incident rates of severe mental illness that have been reported in people of African and Caribbean origin. Admission rates reflect the prevalence of that illness. However, national community-based prevalence studies have not found high rates of psychosis or other serious mental illness that could account for these findings. So if we look at Frank Keating's study, where he talks about moving things on in terms of the relationship between Black communities and the mental health services. And what he says is that these services are fraught. They are they are sometimes very adversarial. Paradoxically, he says that Black communities receive the mental health services they don't want, but not the ones that they do or might want. Black people mistrust and often fear services, and staff are often wary of the Black community, fearing criticism and not knowing how to respond. And they are fearful of Black people, in particular, the young Black men. Keating's view is that the situation is fueled by prejudice, misunderstanding, misconception, and sometimes racism. And he states that his study was premised on the belief that there are circles of fear which lead to poorer treatment of Black communities. Two major themes emerged in this study. One was the source of fear, and the other, the consequences of fear. Sources of fear included perception of mental health services, attitudes to mental illness and diagnosis, and experiences of hospital care. The impact of fear included limited trust, limited engagement, and delayed help seeking behavior. His study concluded that these fears mar the interaction between these communities and mental health services, and they affect help-seeking behaviors. So we move on to the experience of Black communities. Basically, Black communities are saying that they want to be able to access services early rather than leaving it too late until the time when they are too unwell and either go through the criminal justice system and into health, or they simply go detained into the health service. So in summary, there is a lot of work to be done. I've cited some of the reports, and what we need to do is, as my conclusions would say, look at the disparities and try and eradicate them. Make services more humane at the interpersonal levels, and looking at positive relationships. So mental health services essentially should build positive working relationships with Black men, Black people, BAME community, and engage with the ideas that they have themselves. Thank you.